breaking the law and ignoring medical ethics. A CNN, IBN, Cobra Post sting operation on top private hospitals in New Delhi exposed how they fail to honor their social responsibility. This sting operation shows how some of those top private hospitals in Delhi are not treating the poor for free. These top private hospitals get their land cheap but evade the social responsibility that comes with it. 7 top private Delhi hospitals turn away a critically ill patient in need of dialysis. RTI documents reveal that these hospitals indeed had beds free when this patient was turned away. Hospital authorities caught on camera show utter disregard for the law and medical ethics.
Saroj Devi lost both her kidneys in 2007. She now needs dialysis thrice a week to stay alive. Her below poverty line card shows that her family earns less than 4,000 rupees a month, giving her the right to free treatment at private hospitals. But in the last 3 months, every private hospital they visited turned them away.
सारे हॉस्पिटल गए थे, सबने मना कर दिया था।
कितने चक्कर लगाए?
कई चक्कर लगाए थे।
और सबने अलग-अलग बहाने बनाए क्या?
हाँ, सबने कह दी कि यहाँ पे जगह नहीं है, बेड खाली नहीं है, जब कोई खत्म हो जाएगा तब आ जाना।
बीपीएल को लगता है
अभी यहाँ पे चले गए। मुझसे बात करने को पहला नहीं है। तो ऑलरेडी ब्लॉक पर है।
The law says these state-of-the-art hospitals must reserve 10% of their beds for the poor. Yet Delhi's poor wait in queues at overcrowded government hospitals. This investigation lays bare the callousness and double standards of Delhi's healthcare giants, exposing how, despite the law, Delhi's poor just cannot access quality healthcare. First, the Max Hospital in East Delhi's Patparganj. A super speciality private facility built on government land sold to them at concessional rates, on condition that 10% of their beds would be for the poor. But when the Cobra Post reporter and Saroj Devi's husband reached Max, this is what the hospital staff said.
प्राइवेट हॉस्पिटल का ट्रीटमेंट 1 साल से आप अफोर्ड कर सकते हो, आप बीपीएल को लगता है मेरा तो सर मकान सारा कुछ हो गया सर, मेरे पास कुछ नहीं है सर। गरीबी रेखा से नीचे आप आते हो लगता है आपको, क्योंकि गरीब आदमी सरकारी हॉस्पिटल के अलावा तो कहीं जा ही नहीं सकता।
Instead of attending to a critical patient, the hospital staff dismisses Saroj Devi's husband.
सर वो बोर्ड आप पढ़ सकते होंगे, कहीं बीपीएल कार्ड के बारे में नहीं लिखा
स्कीम है जो गवर्नमेंट ने दे रखा है इन लोग सहूलियत।
सर स्कीम का मतलब ऐसे नहीं कि आप आए और हमने देना शुरू कर दिया, कमेटी है हमारी, कमेटी अप्रूव करती है।
We then tried to meet the medical superintendent of Max, hoping he would be more helpful. But Dr. Krishnan had only this to say.
नहीं, ये रेशन कार्ड में आपने जो
राशन इनका घर
संगम विहार का एड्रेस है।
इनका घर संगम विहार नहीं है, संगम विहार नहीं है, लेकिन इनकी वाइफ को अटेंड करने के लिए, क्योंकि वो अकेली लेडी है, 2 बच्चे
आप नहीं समझ रहे हैं ना, एक रीजन का आते हैं, इसका रीजन पे नियर बाई जो हॉस्पिटल है, जो प्राइवेट हॉस्पिटल भी होते हैं, जी, उसमें कहाँ पर EWS सेक्शन के लिए इलाज फ्री।
Dr. Krishnan says Max would admit Saroj only after the family got rejection letters from all the hospitals near her house.
But a 2007 High Court ruling clearly says that a critical patient must be treated by private hospitals even if he comes without a reference, and that a patient below the poverty line can go to any private hospital in Delhi. When we contacted Max authorities after this investigation, they refused to talk to us on camera. Instead, they sent us this statement.
We have a committee in place to establish the veracity of BPL admission requests. The process does not take more than 2 hours and is carried as a parallel exercise whilst the admission is being processed. In the said case, the patient was undergoing dialysis at another facility already and had 2 addresses, Sangam Vihar and Lakshmi Nagar. Dialysis patients require routine care, and for transferring from one centre to another, one has to conduct a screening test for medical evaluation. Keeping in mind the patient's convenience, facilities closer to the patient's place of residence were being recommended. Periodic audits by the monitoring committee appointed by the Delhi High Court have found our systems and processes satisfactory. In fact, social jurist and head of the monitoring committee has sent a letter of commendation to the hospital for providing exemplary care to a BPL family.
This is the Escorts Hospital. the city's best-known heart institute, but out of bounds for the poor. Cobra Post accompanied this 14-year-old girl with a heart problem to Dr. V.R. Gupta, medical superintendent at Escorts. Here he is denying them admission.
ऐसा ना मेरे से बात करने को पहला नहीं है सारे डॉक्यूमेंट क्या होने चाहिए कहाँ का बीपीएल आपका अब बिहार का चले गए हमारा सिर्फ दिल्ली का चले गया पहले पूरा इंडिया हो सकता था सुप्रीम कोर्ट ने भी चेंज कर दिया सर वो इसका टाइम नहीं समझ गए.
Not once did the doctor at Escorts ask about the girl's illness. In fact, the hospital even said that only patients holding BPL cards from Delhi could get free treatment. When CNN-IBN questioned why BPL card holders of other states living in Delhi were ineligible for free treatment at this hospital, this is what they had to say.
What it says, and I'm happy to read it out, it says that with the free patient treatment to indigent stroke poor persons of Delhi as specified above. So our understanding and our our legal interpretation of this is people holding a BPL card in Delhi.
Next, we approached Fortis Healthcare in South Delhi's Vasant Kunj, another private hospital that must provide free medical care to the underprivileged. But at the entrance itself, we spot a board that says only concessional treatment will be given to the poor. Once inside, a patient is once again asked for a government referral.
पहले गवर्नमेंट हॉस्पिटल में जाना होता है पहले नहीं हमारा जो सिस्टम है जो नोटरी है वो मदन मोहन मालवीय हॉस्पिटल में वहाँ पे जाना होता है वहाँ पे अगर नहीं हो सकता वहाँ पे जो सर्विस अवेलेबल नहीं है उसके लिए आप प्राइवेट हॉस्पिटल में आ सकते हैं.
Dr. Sushmita, PA to the medical superintendent at Fortis Hospital, almost made up her own rules. When asked about how many beds were available for the poor, she was caught off guard.
क्योंकि आपके यहाँ बेड्स तो अवेलेबल हैं और वो
बेड्स अवेलेबल
नहीं अब बाहर लिखा हुआ है 11 बेड्स हैं जो फ्री बेड्स और अभी कोई भी ऑक्युपाइड नहीं है नील है आज की डेट में ये रिसेप्शन में ये तो.
At last, an honest answer. The law says private hospitals must update and display the number of free beds available daily.
नहीं से अपडेट नहीं हो सके ये फ्री बेड्स जो होते हैं.
A law Fortis ignores. In fact, the medical superintendent says Fortis had no dialysis facility for Saroj Devi.
सर उसे इंसिडेंट में बोला गया था वहाँ पर जो 9 नंबर ओपीडी है वहाँ पर ये बोला गया कि ऐसा है कि आप जब जाइए प्राइवेट हॉस्पिटल में और डायलिसिस सारा कराते हैं. डायलिसिस आता हम नहीं करते वो कहते हैं हम लोग को रेफर भी करते हैं पर मेरे पास बात तो कोई रखते नहीं होता. डायलिसिस इज नॉट इन पेशेंट बेड्स कि जो कि नॉमिनेट कर दी जाए फॉर ईडब्ल्यूएस.
Clearly not. Private hospitals are required to reserve 10% of inpatient beds and 25% for outpatients. Saroj Devi went to Fortis on 6 different days pleading for a 4-hour dialysis slot. Each time she was told no vacancy. This investigation checked the facts through RTI. On 5 of the 6 days that Saroj was turned away, all 11 beds meant for the poor at Fortis were totally vacant. When CNN-IBN confronted the hospital, this is what they had to say.
I really don't want to get into these, pulled out random examples from 3 months or 1 year ago. We take our responsibilities very seriously to the extent that when there are people who, for some reason, we can't accommodate, we would see what we can do under the Fortis Foundation. And there is a bunch of things over here at Fortis Vasant Kunj, and dialysis is not one of those things.
Ignorance of the law or a ploy to refuse poor patients. Different excuses, but the story was the same across hospitals in Delhi. A poor patient was just not welcome. No one ever rejected outright. The hospitals either misled or gave inaccurate information to a patient who was only asking for healthcare she deserved. With Raju Gupta, Asid Dikshit and Sarla Rawat from Cobra Post and Smriti Advani in New Delhi, this is Divya Iyer.
As many as 7 of Delhi's healthcare giants with much to answer for. We'll have more details of that investigation that will play over the next 60 minutes. Our reporters who are part of this investigation, along with reporters from the Cobra Post, are joining us on 8 p.m. Prime tonight. Divya Iyer is joining us from outside the Max Hospital in the capital. Smriti Advani from Fortis Escorts in Delhi as well. We're also joined tonight by Delhi's Health Minister Kiran Walia. Before I come to our reporters, in the process we adopted in the due diligence while we filed this special investigation, I'm going to go across to Delhi's Health Minister first. Ms. Walia, thanks very much for joining us tonight. You heard us play that first report out. Prominent hospitals of Delhi ducking their social responsibility, turning away a genuine dialysis patient. Your first reactions, ma'am. Are you shocked?
It's not only because the High Court decision says, verdict says that not only, the BPL category, but if a person gives a self-certification that he's poor and gives ample evidence to the fact that he is poor, they have to take a patient. Nobody can turn away a patient like this. I fully appreciate, the fact that you have carried out a sting operation, because we have to, check on these private hospitals, which we are trying to do, and have a monitoring committee which goes to see almost every month that what is the number of beds that have been occupied by the poor patients, which make a proportion of 10%.
Right, but Ms. Walia, this report is also the other report that we will play out goes to show just how this is not a one-off case. This is in fact appears to be institutionalized. The fact is that the monitoring mechanism you're referring to doesn't appear to work. We have their refusals, their excuses, if one may, on hidden camera there, and subsequent RTI documents to show that beds were available on those days. It's a total breach of the law.
I fully agree with what you're saying. It is a breach of law, and it is for us to come with more stringent measures to ensure that, and we're already on our job as to how best we can ensure compliance. Talking in general terms first, and then coming to the specific case. In general terms, I would say that we want the whole system to be more accountable, to be more transparent, and they should be having a nodal officer and a clear display of who, as to indicate where should the poor patient go in this private hospital, who would help him out, that people don't even know which is the desk to go.
Right. How do you implement those plans that you have is really the question. But let's now go across to Divya Iyer and Smriti Advani, our reporters who've been closely monitoring this investigation. Divya, first to you, the fact that the people who were met with in the hospital, who we asked for responses, aren't really some low-level staff. These are senior management employees of the hospital who we had posed those questions to.
Absolutely, and as the minister says, it is really important to have nodal officers and someone who will tell you right at the reception where to go, especially for poor people who cannot read, who are any day overwhelmed with a big hospital. But forget all of that. Even if for one instance we believe that they have crossed all these initial hurdles, they are meeting the medical superintendent, the MS of a hospital. You cannot get higher than that in terms of authority, in terms of knowledge, in terms of compassion, so to say, for a doctor. But if these people are found on camera evading questions, interpreting the law in their own way, basically turning away patients for different excuses, it is a shame. Regardless of whether a patient is poor or rich, the fact is, and the larger point that this investigation brings out is a patient, a genuine patient who was in critical need of dialysis with 2 kidneys having damage, has gone to 7 top hospitals across Delhi without getting treatment. Now, for any person, any patient, regardless whether it's poor or rich, it is a huge concern and an issue that we need to tackle with.
Right, Divya, just to give a better sense to our viewers who may be wondering that possibly there would have been people in the hospital that we approached who would have been possibly busy, didn't know how to interpret the law, as it were. Give us a specific instance, a particular case in brief, to explain how we look to approach people in positions of authority who would know what the law actually spells out.
The common point between most of the hospitals, and this is the largest excuse that we found, which was similar, is that all of them said a government referral is important. In fact, they said it's mandatory. So their entire point of view was, if a government referral comes saying the government cannot accommodate a patient, only then will we take it. Also, if the facility that the government hospital does not provide, it is only those facilities which we can provide. This is really turning away the patient and asking him to run around for a simple basic need, when the law clearly states, and the High Court ruling is there of 2007, it clearly states that any patient, especially in critical need, could be taken in even directly. And as the minister herself pointed out, even a self-certification is enough. You do not need a BPL card. That was one of the largest excuses. The other being that we do not know, beds are completely full, there is nothing vacant, and as the RTI shows, which we have showed in our investigation, the beds were available.
That's right. That's pretty much the question I'm going to pose to Smriti Advani. The fact that the RTI revelations show that these hospitals had beds. It's just the question of not having the heart to accommodate poor patients.
That's right, Veera. In fact, when we approached the hospitals with that exact same question, asking why, when the RTI document clearly shows that the beds meant for free patients were unoccupied and they were still not giving them to the patient concerned, the most common excuse that the hospital staff gave us was that the information has not been updated. Now, we have checked with lawyers, with the government authorities, and all hospitals are required under government guidelines to submit exact details of how many beds are free, how many are meant for poor patients at the end of every day. And if those records aren't being updated and maintained every day, then there is something that the government really needs to look into seriously.
Right. Just to tell our viewers also, Smriti, the RTI applications we filed to get the information on just how many of those beds that were meant for the poor were occupied or unoccupied. We put in an RTI application asking for details of the specific date on which we shot at these hospitals, carried out that sting operation in the hospitals that we refer to in our report. Ms. Kiran Walia, I'm going to come back to you and asking you that question. For those who are watching you tonight, just what is the message going out to the poor in Delhi? There are lakhs of them, that private hospitals, that many of them built as laborers, some would say, are shut to them. Just what's the message that goes out?
Something more stringent has to be done to bring these private hospitals more accountable and complying with the rules and regulations and even high court verdicts. But at this particular case which you are referring to, I would definitely like to know who the patient is. I would like to know the details. I'd really appreciate that apart from, you're coming and interviewing me, if something in writing comes from your channel, but suo motu I will take up this case. And I will really be very happy if some of the relatives of the patient come and meet me in the office tomorrow, and I will ensure that all these hospitals will have to be answerable as to how and why this happened.
Right. The question is, will it all be implemented? Can we ensure that corporate hospitals do have the heart, if not the beds, for the poor? Thanks very much, Kiran Walia. Appreciate you joining us on the Cobra Post CNN IBN sting operation. Also to Divya Iyer and Smriti Advani for giving us the latest on the responses that those hospitals had to have for their absolute apathy towards the poor. Well, now shifting focus, we'll also, remember, we'll continue to track this investigation. We'll expose more of how Delhi's corporate hospitals turned away poor patients. We'll be joined also by a man who doesn't turn away poor patients, Dr. Devi Shetty of Narayan Hridayalaya, and Kiran Walia also may return to the show.